right, future doctors, welcome back. Today, we're jumping into a super high-yield topic for your exams, the complete arsenal of virulence factors used by Streptococcus pyogenes. You probably know it as Group A strep, or GAS. We're going to open up the playbook of one of medicine's toughest bacterial foes. So you have to ask, right? How does this one little bacterium pack such a massive punch? I mean, it causes everything from a basic sore throat to life-threatening toxic shock syndrome. Well, the answer is all in its incredible toolkit of virulence factors. And that's exactly what we're going to break down, one by one.
So, here's our game plan for today. We'll start with a quick intro, then we're going to dissect its structural weapons, its chemical warfare, and its infiltration tools. And to make sure this all sticks for your boards, we're going to wrap up with a rapid-fire, high-yield recap. You ready? Let's do it.
Okay, let's get right into it. Section 1, the gas arsenal. And I'm telling you, understanding these weapons is absolutely fundamental to understanding the diseases this little guy causes.
Think of gas as virulence factors in three main buckets. First, you've got the cell wall antigens. These are like the bacterium's armor and its grappling hooks. Second, the toxins. These are its secreted poisons. And third, the enzymes. These are the break-in tools it uses to spread through the body.
Let's kick things off with that first category. Section 2, structural weapons. We're talking about the components right on the bacterium's surface. This is its first line of attack and defense.
Okay, so before we get to the main event in this section, let's talk about the supporting cast. You've got lipotetroic acid and the E factor, which basically act like glue, helping it stick to the cells in your throat. The C carbohydrate, well, that's the antigen we use for Lancefield grouping. And then there's the hyaluronic acid capsule. Think of this as an invisibility cloak. It's antiphagocytic, helping the bacterium hide from your immune cells.
But the undisputed superstar of this whole section, and I can almost guarantee you'll see this on an exam, is the M protein. If you remember one thing, it's this. The M protein is the principal virulence factor of Group A strep. It is the single most important piece of equipment it has for survival and for causing disease.
So, what does this M protein actually do? Well, it launches this crazy four-pronged attack. First, and most importantly, it stops phagocytosis. It just blocks our immune cells from eating it. Second, while our body does make protective antibodies against it, some types of M protein have a darker side. Third, it can bind to fibrinogen, which causes vascular leakage, a key step in toxic shock syndrome. And fourth, and this is critical, it causes autoimmunity. It actually cross-reacts with our own heart tissue, and that's what leads to the devastating complication of rheumatic fever.
All right, let's pivot. We're moving on to Section 3, chemical warfare. So if the structural factors were the bacterium's armor, these are the secreted poisons that cause direct damage to our cells and just wreak havoc on our bodies.
Okay, this slide is a classic exam head-to-head. You have to know the difference between these two hemolysins. Over on the left, Streptolysin O. The O is for oxygen labile, meaning it's destroyed by oxygen. It's super antigenic, and that's huge because it's why we can measure anti-Streptolysin O, or ASO, antibodies to diagnose an infection. Now on the right, Streptolysin S. S is for oxygen stable, but here's the key difference. It's not antigenic. So you can't do an ASO-like test for it. This comparison is absolute gold for your exams.
And hey, need a quick way to lock that in for Streptolysin S? Here you go. Just remember that the letter S stands for both oxygen stable and serum soluble. Simple, right?
Next up in the toxic arsenal are the streptococcal pyrogenic exotoxins, or SPE for short. You've got three main types to know: A, B, and C. Now the name says it all. Pyrogenic means they cause fever. These are also the culprits behind that classic sandpaper rash in scarlet fever, and they play a central role in the really scary stuff: necrotizing fasciitis and toxic shock syndrome.
So how in the world do they cause so much chaos? Well, spec A and spec C are what we call superantigens. See, a normal antigen only activates a very specific T cell, but superantigens, they just bypass all the rules and cause this massive, nonspecific activation of T cells. This leads to a cytokine storm, a crazy, overwhelming release of inflammatory molecules that causes the super high fever, the shock, and the tissue damage you see in toxic shock syndrome.
And that brings us to our final category, Section 4, infiltration tools. You can think of these enzymes as the bacterium's molecular scissors. They just go around breaking down our tissues to help it invade deeper and spread farther.
First up is Streptokinase, which you might also see called fibrinolysin.
This enzyme is a serious clot buster. It activates plasmin, which then just dissolves the fibrin clots that our body tries to form to wall off the infection. This lets the bacteria spread freely. And here's a really cool clinical tie-in. We've actually harnessed this weapon for good. Streptokinase is used as a drug to dissolve clots in heart attack patients.
Next is streptodornase, or DNase. Its job is to liquefy pus by breaking down all this sticky DNA from dead cells. This thins out the pus, making it way easier for the bacteria to move around. Now, for your exams, here's the key takeaway. It's all about the diagnostic use. We measure antibodies against DNase B to look back in time and diagnose skin infections and post-streptococcal glomerulonephritis.
And this right here, this is an incredibly high yield point that trips up so many students. So please, burn this into your brain. For strep skin infections, like pyoderma, the ASO titer is often low or even negative. In those cases, the anti-DNase B test is the better test. It is the go-to serological marker to confirm that a strep infection happened.
And just to round out the picture, there are a few other enzymes working in the background. You've got hyaluronidase, which is the classic spreading factor because it dissolves the glue that holds our connective tissue together, and C5a peptidase, which cleverly messes with our complement system to slow down our immune response, and a few others, all working together to help the bacteria get a foothold.
Phew! Okay, we have covered a ton of ground. So now let's make sure it's all locked in for your exams with Section 5, the high-yield recap. Just think of these next few slides as your digital flashcards. Okay, first up, M protein. What is it? The principal virulence factor. What's its deal? It's anti-phagocytic, and its cross-reactivity is the link to acute rheumatic fever. Got it?
Next, the toxins. Streptolysin O. It's antigenic, so we have the ASO test. Streptolysin S. Not antigenic, so there's no test for it. Simple as that.
Remember those SPE toxins? Especially A and C. Think super antigens. They're the culprits behind that massive cytokine storm that causes toxic shock syndrome and the rash and scarlet fever.
And finally, our key diagnostic distinction. When you suspect a previous skin infection or glomerulonephritis, and that ASO test is coming back low, your test of choice is anti-DNase AB. Absolutely crucial.
So, we've gone through the entire pathogens playbook. I want to leave you with one final thought to tie all this together. When you consider its structural defenses, its powerful toxins, and all those invasive enzymes, which factor, or maybe which combination of factors, do you think truly earns Streptococcus pyogenes that terrifying nickname, the flesh-eating bacteria? Something to think about. Thanks so much for watching.